this is Cecilia Grossman of Naturopath Solutions. Today we're going to talk about cholesterol-lowering drugs known as statins. Before the 1900s, although heart disease did exist, it was few and far between. Even in the early 1900s, doctors could spend their whole working life without seeing a case of a heart attack or stroke. Now, that's unheard of today. We all know people who have had heart attacks and strokes and sadly even died from it. So something has drastically changed. In the 1950s and 60s, it was strongly believed, due to the work from Dr. Ansel Keys, that saturated fats and cholesterol were the highest modifiable risk factors of heart disease, and so we had to drastically lower our intake of saturated fats and cholesterol. And the pharmaceutical companies also came into it, and they thought, well, we can also do it artificially with medication. And they produced statins, which are definitely known to reduce your cholesterol levels. These statins are now the biggest selling medication in Australia, and definitely in the top 5 worldwide, maybe in some countries also the biggest seller. So you would think that if pretty much everybody over a certain age were on statins, that we would see a significant decrease. Now, I wanted to check that out. I wanted to see how well statins were doing. I started looking at studies, but I thought I can do better than that. I just simply Googled the statistics of the country. Now, I live in Australia, so I wanted to know what the incidence of heart disease was in Australia and the incidence of mortality or death from heart attacks and strokes in Australia. I thought that was a good place to go, and you can do that yourself. Doesn't matter what country you belong to. These statistics are readily available. So, what did I find out? In 2007, from 2007, 2008 to this day, there's been a 2.2% increase. Excuse me, we're looking for a decrease here, not an increase. Doesn't matter that you might say 2.2 doesn't sound a lot. And doesn't matter, you might say, that maybe it was higher before. We don't want an increase. We want a decrease. There's something wrong here. We have a population here in Australia of 24 million. 4.2 million people are affected by cardiovascular disease. That's 1 in 6. That's a big statistic. In 2017, 43,477 people died of heart disease. That's one person every 12 minutes, which accounts for approximately 119 people a day. One person would have been too many a day. Would you agree with that? 119 is staggering. Something's not right here. We would assume if we have the highest selling drug and so many people are taking it, why haven't we seen a decrease? I think that's a good question, don't you? Now, is cholesterol really the bad guy? Do we have to shoot cholesterol? Why is the body even producing it if it's so bad? Well, that's just it. The body is pretty clever. It produces vital products. It's not going to waste its energy and produce something it doesn't need. And you could not survive a day without cholesterol. Cholesterol is intricately involved in the makeup of your cell membranes, of every cell. And what is the body? The body is a collection of cells. Those cell membranes protect what comes in and what comes out, and it needs cholesterol to do that. Cholesterol is involved in the myelin sheaths and the production of myelin sheaths around every nerve. It's involved in the production of sex hormones and adrenal hormones and vitamin D. And it's involved in the production of bile salts, which are needed to digest your fats and for detoxification, and it's even bactericidal. So you can see that all those functions are vital for the body, and cholesterol is really involved in the production of all of them. So why would we then artificially reduce cholesterol? To me, that's not a good thing. And I must add here that those elderly people that had high cholesterol in their brain had less chance of dementia than those people who had reduced cholesterol in their brain. No, cholesterol's important. Where cholesterol can be a problem is oxidized cholesterol. The LDL cholesterol is quite vulnerable to oxidation. And oxidized cholesterol can be hard and sticky and can cause damage to the blood vessels. But it's really collateral damage to oxidative stress. What we should be looking at is decreasing oxidative stress. And then we might decrease the amount of LDLs that are affected. That's where we should be looking at. How do we get lots of oxidative stress? From insulin resistance, from blood sugar dysregulation, from inflammation. We should be reducing these. And when we look at our blood tests, it's the high triglycerides which are a factor. High triglycerides are known to cause liver damage, inflammation, and oxidative stress. We also want higher HDLs. But there's no medication to lower triglycerides. There's no medication to increase high HDLs. There is only medication to reduce LDLs. And that's why statins are pushed. So let's look at another thing. And it's not just oxidation we should be looking at. We should be looking at our microbiome. This is all very new research where we're finding that the bacteria in our body helps transform the bile salts so that excess cholesterol can get passed out of the body. If you have an imbalance in good and bad bacteria, you're not having that biotransformation of the bile salts, and the cholesterol gets recirculated, which adds to the cholesterol that's already being produced in the body, and we might have a problem there as well. Now, what we also need to look at when we're looking at this topic of statins is the side effects of statins. Now, you might say, well, statins, the benefits might outweigh the risks, right? If it prevents heart disease, and we just need to ignore the side effects because the benefit is so important. Well, first of all, we found that maybe they weren't doing so much what we thought they were doing. But anyway, let's look at the side effects. There's a high incidence. I think it's thought to be 1 in 5 patients end up having muscle pain and muscle stiffness. So much so that many stop taking their medications, they can't take it, and stop if they're a participant in the study, they drop out. So a lot of studies are really done with people who don't have side effects, which isn't a very good sampling. Now, why do people have this muscle pain? It's because the pathways that are affected by the statins, the pathways to decrease cholesterol, also affect the production of CoQ10. CoQ10 is needed in every cell, in every body. It's found in the mitochondria, the energy factories. It's intricately involved in the production of energy, and it's also involved as an antioxidant to deal with the oxidative stress as a byproduct of energy production. So the organs that use the most energy need the most CoQ10, like the brain that uses 20% of the body's energy. Isn't that a huge number? And the liver that needs a lot of energy because it does so much. And the muscles need a lot of energy, right? The muscles where the pain is. And think about it, the heart. The heart pumps 24/7. If you don't have enough CoQ10, your heart is going to be affected, and that's going to increase your cardiovascular disease risk. So you take a statin to reduce your cholesterol, to reduce your incidence of heart disease, but by doing that, you're reducing the production of CoQ10, which can raise your risk of heart disease. Let's look at some more side effects. They increase the amount of liver enzymes in your blood. Most of the liver enzymes should stay in your liver. And if the accumulation of liver enzymes happens in your blood, that's showing that you have liver damage. We need a healthy liver. We need to synthesize a lot of compounds in the liver and to deal with detoxification. In this day and age, in the 21st century, with all the toxins we're subjected to, we need a healthy liver. There's another problem with taking statins. It increases your risk of diabetes. And diabetes is a major risk factor to heart disease. So again, you take your statins to reduce your cholesterol, to reduce your risk of heart disease, but the chance of you getting diabetes might increase and you get diabetes, and then you increase your risk of heart disease. There's something wrong with that equation, right? I want to add another thing. I was recently listening to a YouTube clip because I was researching this talk. And this top cardiologist from the Mayo Clinic was being interviewed. His job was to put people at rest, to say that, yes, statins do help. So I was stunned. In his argument that statins do help, he actually said this categorically. I did not misinterpret it. He said those people who do not change their diet and lifestyle will have no effect from statins. Now, you know as well as I do that most people going to the doctor that are prescribed statins do not change their diet and lifestyle. This is where we should be looking. This is number one in preventing heart disease. We need to increase our vegetables and fruit, brightly colored vegetables and fruit with lots of polyphenols and antioxidants and fiber to improve our microbiome. We need to decrease simple carbohydrates and processed goods to again decrease our oxidative stress, but also to increase the incidence of insulin resistance and high triglycerides. And we should be decreasing our body weight and increasing our exercise. I mean, that's just a few of the things that we should be doing. And they're more important than taking statins. Yes, if you've had an event like a heart attack or a stroke, it still might be beneficial on top of all that to maybe take a statin. But that depends. But it's not happening, is it? People aren't changing their diet and lifestyle, which is really sad. If you are someone that is over the age of 50 and are worried about the increased risk you might be having, please don't take what I say as the be-all and end-all. Do all your research, question, come to your own conclusions. But, look at all the research before you make a decision. And I hope you enjoyed this video, and I hope you tune in next time. Take care. Have a lovely day.